There is a moment that changes everything, and most people do not recognize it until it has already happened. You are over 65. You are active. You swim, you cycle, you walk the dog every morning without fail. By every reasonable measure, you are doing the right things. Then one evening, you miss a step on the stairs. Not a dramatic fall, just a fraction of a second where your leg did not respond the way you expected. Your knee buckled slightly. Your hand shot out for the railing, instinctively before your brain had even processed what was happening. You caught yourself. This time. But that involuntary grab for the railing is not a coincidence. It is not clumsiness. It is a precise neurological signal, your body telling you that the muscles responsible for catching you in that split second are no longer strong enough to do their job reliably. As a physiotherapist specializing in geriatric rehabilitation, I have worked with thousands of older adults, and I can tell you with complete certainty, the patients who fall are not the ones who are inactive. Many of them are remarkably active. They are the ones whose training has a specific, critical gap. In this video, I am going to show you exactly what that gap is. I will give you a 4-step exercise plan, no gym, no equipment, no floor work, that directly targets the muscles responsible for keeping you upright, stable, and independent. And we are building toward one single movement that rehabilitation science has identified as the most powerful predictor of long-term mobility in older adults. Stay until the end, because I will also show you the precise execution protocol and the one timing mistake that makes this movement almost completely ineffective. To understand the gap in your training, we need to talk about what happens to muscle tissue after the age of 60. There is a process called sarcopenia, the age-related loss of muscle mass and function. It begins gradually in your 40s and becomes clinically significant after 70. But sarcopenia does not affect all muscle fibers equally. The fibers that deteriorate fastest are your type 2 fast-twitch fibers, the ones responsible for rapid, powerful contractions. These are the fibers that fire in the first 200 milliseconds after a stumble. They decide whether you catch yourself or hit the ground. Endurance exercise, swimming, cycling, walking, preserves your slow-twitch fibers beautifully, but it does almost nothing to slow the loss of type 2 fibers. A paper published in the Journal of Applied Physiology found that by age 70, the average adult has lost up to 35% of their fast-twitch muscle fiber area, regardless of their general activity level. The solution is not to exercise more, it is to exercise differently, to apply controlled resistance in a way that forces type 2 fiber recruitment. And the research is unambiguous. These fibers can be rebuilt at any age. The body does not stop responding to the right stimulus. It simply stops receiving it. We are now going to give it exactly that stimulus, with 4 targeted movements, all performed from a chair. Number 4. Seated ankle circles with resistance, the joint primer. We begin with the foundation. Everything else depends on. The ankle joint is the first point of contact between your body and the ground. Its mobility and proprioceptive sensitivity decline significantly with age and inactivity. Research published in Gait and Posture demonstrated that reduced ankle dorsiflexion was independently associated with a 48% increase in fall risk in adults over 65. Lift your right foot slightly off the ground. Draw large, slow circles with your foot, 10 clockwise, 10 counterclockwise. Then flex the foot hard toward the shin. Hold 3 seconds. Point away, hold 3 seconds. 5 repetitions. Switch sides. This is not a warm-up. It is targeted proprioceptive training, reactivating the sensory nerve pathways that tell your brain exactly where your foot is in space. Number 3. Seated glute contractions with hip hinge, the pelvic stabilizer. The gluteus medius runs along the outer hip and stabilizes your pelvis with every step you take. When it weakens, the pelvis drops to one side, creating the side-to-side sway that accelerates fall risk and hip joint deterioration. A study in the Archives of Physical Medicine and Rehabilitation found that targeted gluteus medius strengthening in adults over 65 reduced lateral trunk sway by 31% after 8 weeks and improved single-leg balance time by an average of 19 seconds. Sit on the front half of your chair. Squeeze your right glute as hard as possible, isolating it, not tensing the whole leg. Hold 5 seconds. Release. Switch sides. 10 repetitions per side. Then add the hip hinge. Hinge forward slowly from the hips until your chest is over your knees. Hold 3 seconds. Return upright. 5 repetitions. This activates the entire posterior chain, the primary system responsible for postural stability. Number 2. Standing wall press. The functional push stand. Facing a wall, one arm's length away, palms flat on the wall at shoulder height, feet hip-width apart. A 2021 study from the University of Sydney found that closed-chain upper body exercises, hands in contact with a fixed surface, activated core stabilizers and lower limb muscles at 40% higher intensity compared to seated upper body work. Slowly lower your chest toward the wall over 3 seconds. Pause 1 second. Press back over 2 seconds. Keep your entire body in one straight line, heel to head. Hips do not sag. Lower back does not arch. Legs, core, and shoulders work simultaneously. Perform 12 to 15 repetitions. Step further from the wall as you grow stronger. Your ankles are primed. Your glutes and posterior chain are engaged. Your core and lower limbs have been loaded. The foundation is set. We are now arriving at the movement that rehabilitation scientists, geriatric physiotherapists, and sports medicine physicians consistently identify as the single most important exercise for preserving lower limb function in older adults. Not because it is the most dramatic, but because it replicates the exact neuromuscular pattern your body uses every time it must recover from a loss of balance. Number 1. The heel-to-toe tandem. Stand with progressive load. The balance master. Stand behind a stable chair and hold the backrest lightly, fingertips only, not gripping. Place your right foot directly in front of your left, heel touching toe, as if standing on a tightrope. This is the tandem stance. Now gradually reduce your grip, first to fingertips, then to one finger. Then hover your hand just above the backrest without touching it. Hold for 30 seconds. The landmark science. A study published in the British Journal of Sports Medicine followed 820 adults between the ages of 51 and 75 over 10 years. The single strongest predictor of mortality and loss of independence was not grip strength, not walking speed, and not cardiovascular fitness. It was the ability to hold a 10-second unsupported tandem balance. Adults who could not hold this position had an 84% higher risk of death from any cause within the following decade. But the tandem stand is not merely a test. It is a training tool. Every second you hold that position, your ankle stabilizers, deep spinal muscles, hip abductors, and vestibular system are all being trained simultaneously. It is the most neurologically complete balance exercise that exists, and it requires nothing but a chair and 30 seconds of your time. The progressive protocol. Week 1 to 2. Both hands on the chair back. Hold 30 seconds. 3 sets per side. Week 3 to 4. Fingertips only. Hold 30 seconds. 3 sets per side. Week 5 to 6. One finger. Hold 30 seconds. 3 sets per side. Week 7 onward. Hands hovering. Eyes open. Hold 30 seconds. Then, when ready, attempt with eyes closed for 10 seconds. Eyes closed tandem balance is the gold standard of vestibular training. It forces your body to rely entirely on proprioception and inner ear input, the systems that operate in the dark, on uneven ground, and in the fraction of a second after a stumble. If you cannot hold the tandem stance for 10 seconds in week 1, do not be discouraged. Research shows consistent daily practice produces measurable improvement within 14 days in adults of all ages. Swimming is wonderful, cycling is excellent. Walking is irreplaceable for your cardiovascular health and your mental well-being. But none of them train the neurological precision your body needs to stay upright when the ground shifts beneath you. The formula for genuine, lasting independence is not more movement. It is the right movement, targeted, progressive, and consistent. Use the ankle circles to keep your foundation sensitive and responsive. Use the glute work to stabilize your pelvis with every step. Use the wall press to load your entire kinetic chain in a standing position and make the tandem balance your daily, non-negotiable 2 minutes. Your nervous system does not have to deteriorate. Your balance does not have to decline. Your body is waiting for the right signal. Give it that signal. Start today. And stand with certainty.